I'm going to tell you about Mastermind Norway, which is part of the EU project Mastermind. What we want to create is a coherent step care model for depression treatment, from self-help to advanced specialist mental health care. But we want to keep it truly patient-centered. We want to have a collaboration over the administrative borders by keeping the patient-centered focus. And we also want to use extensive use of modern technology. We want to create a system that secures early intervention for depressed citizens and that hinders medicalization and institutionalization. We want to preserve the strength and the citizens' autonomy, and we want also the citizens to be able to cope, to prevent them from being patients. So we want to strengthen and increase the coping of the patient, but also of the healthcare system by education and securing good professional and technical support at all levels of the healthcare chain. One could compare this system to a funnel with fewer and fewer people as we move through the funnel. Sounds like a crazy idea, but what we can do here is at one end of the funnel, with the most people, we have self-help, internet-based cognitive therapy without assistance from the healthcare worker. Some people would need more support, and they will work with the program guided by the GP. And that will be done in a stepwise manner, where we start from minimal assistance, and if that doesn't work, we increase the assistance and the follow-up. Now then we could have a situation where the GP finds that it is not good enough, the patient is not improving, and at that time we will then have the specialist assist the GP. So the GP can ask for advisory video assistance, and the specialist will be at the hospital and the patients would be at the doctor's office together with the GP. So it's a triangular, it's a specialist at video and the GP and the patient at the office. Naturally, one could also then ask for the GP to send the patient in the normal way by a referral, and the patient would then be on a waiting list. When the patient is on the waiting list, the patient is in the realm of the specialist healthcare, and there also the specialist would be able to use assisted cognitive therapy, internet-based cognitive therapy. Also, the specialist can offer video consultations to patients at home. And finally, we can get professional and specialist healthcare service that communicate with the polyclinic, with the central university clinic. In this way, we hope that we can be able to transfer the knowledge that the specialist university clinic have to the polyclinic and further on to the GP and to the patients. And that's the whole philosophy of our part of Mastermind. Thank you.